Some lawmakers have expressed more concern about their constituents' mental health during this legislative session than they have in prior sessions.
We are seeing students trying to commit suicide, and unfortunately, some of those actually succeed.
Our children, some are contemplating suicide.
And so, what do we have? We have a growing suicide rate.
According to Health and Welfare, in 2020, 420 Idahoans died by suicide, while in 2019, that number was 362. But in 2018, Idaho saw 409 deaths by suicide, nearly as many as in 2020. While the suicide rate in Idaho is jarring, the problem isn't new. In 2018, Idaho had the 5th highest rate of suicide in the country. Statewide, it was the 7th leading cause of death.
It's interesting to me when you start talking about suicide, most people know someone, either first degree, second degree, or third degree, someone that has suffered a loss or has lost someone to suicide. And many want to talk about it.
Prior to the pandemic, not all lawmakers were as vocally concerned about mental illness, nor were they concerned about funding treatment options. In a February of 2020 House Education Committee meeting, some members did not support the idea of providing schools with funding for training teachers to help students with social-emotional issues.
We're talking about more time spent in an area with kids and teachers that really is a role that should be dealt with in the home. And it seems like everything is flipping. So now we're going to deal with these things that should be dealt with in the home, and then the home is going to try to teach math. It seems like we keep coming up with programs that cost money, and we're throwing darts at the dartboard trying to find things that are going to stick.
Representative Ehart said she has always supported suicide prevention and mental health treatment options. But last year, she had concerns about how the social-emotional training would be used.
And we have to understand that social emotional deals with behaviors and attitudes. And when we deal with behaviors and attitudes, we are talking about an area that our teachers literally aren't trained to delve into. This is where professional help is needed. I'm actually advocating that we need to quit pouring on more and more and more to our teachers' plates and asking them to deal with things in which they're absolutely not equipped to deal. And that if we're going to deal in that realm, we need professionals who are professionally trained.
In prior years, lawmakers have provided funding for needed crisis centers in some areas of the state, which experts say has been helpful.
In North Idaho, we're extremely fortunate. We have a crisis center that's 24/7, and this is a resource that came to us a few years ago, and it's been just invaluable in the sense that anyone can go there that's in any type of crisis and get some help.
But none of those crisis centers are able to treat patients under age 18.
Last month, February 2021, the hotline received nearly 1,400 calls, and that is up 30% from February of 2020. Call volume has increased over the years since we started in 2012. One parting thought I want to say is that often when I speak to any group of people, sometimes people ask, or if they don't ask, I think they might think that people who call the hotline, people that call other crisis services aren't like us. But they are like us. They are us.
Idaho lawmakers have one resolution making its way through the State House this year in an effort to support suicide prevention. The resolution passed the House unanimously and would acknowledge that 988 be the new 3-digit number for suicide prevention and mental health crisis. The legislation comes after Congress approved the decision through the National Suicide Hotline Designation Act of 2020. In July of 2022, 988 will go live and replace the current National Suicide Prevention phone number.
And I think that that's what it takes. It takes everybody's interest. And I see it here in North Idaho. And it's throughout Idaho. People do care about suicide loss, and they want to prevent suicide loss. They just need to become comfortable with asking the question and understanding where they can refer that person.
Discussions about mental illness and asking a person if they're thinking about hurting themselves isn't easy, but it is necessary.
Reach out. It's okay to ask. It's okay to help.
For more information on suicide prevention, visit the Idaho Suicide Prevention Hotline at idahosuicideprevention.org or call or text 208-398-4357.